Welcome back to GoodX Web Fundamental Training. We are busy now with the clinical info in this session that we are going to handle. We already covered the introduction, we covered the appointments, and also we covered the diary administration. Now the important part for the doctor itself is the clinical information, because you have to keep clinical information of the patient for court, and if there comes legal problems in, then you need your clinical information. Now the best of GoodX Web is the clinical information for me, and it has a really lot of functions in the clinical information. You have a lot of pictures that you can use and can sign on. I'm going to show you some of the functionalities that GoodX Web have in the clinical information. So if we're going to go to the GoodX Web diary and we click on one of the patients, you will see immediately from here we can make a script without even going into the clinical information. Now you can decide on which buttons do you want to see here, and then as a quick access, and you can tell us which one we have to put here for you. Now if we say on this patient, we're going to say this patient is ready, so the patient is going to go into the doctor's practice, or into the doctor's consultation room, and now we're going to say clinical. Now from here, your first part is to put in the medical history of the patient. When the patient comes for the first time to your practice, complete the medical history part, because in the medical history part you're going to complete the chronic conditions of the patient, the allergic problems that the patient has. All of that information is important for you when you start billing on the patient. Now the system will warn you if you give a script out to the patient or bill the patient that the patient is allergic to some certain medication or natural substances that the patient is allergic to, or he is on certain chronic conditions. Now we also have a drug interaction rules inside GoodX that is really cool. It will tell you, say for instance you subscribe for the patient Bernardo, and also you prescribe pain block for the patient. It's going to give you a warning and tell you no, but both of this medication that you prescribe to this patient has paracetamol inside. Are you sure you want to overdose the patient? Now that is still your option if you want to give the medication, because say for instance the Bernardo doesn't have enough paracetamol in, for instance, then you can give another one, or maybe it works nice together. And it's still your choice, so it's only a warning that the system will give you and tell you, okay, are you sure you want to continue? And then you can say yes, you want to continue and you want to overdose the patient, for instance. Now we're going to click on medical history. Here you will complete the general history. Is the patient smoking? How many times per day is the patient smoking? Is he using alcohol? Is he exercising? And also is he using any drugs? Now some patients won't tell you if they are using drugs, but then you can leave it blank, not filled in, or you can choose from the list. Is it never, previously, regularly, occasionally, or rare? Now from here, exercise is how many times per week is the patient exercising. Let's take 2, and we'll say here never. And alcohol per day, not alcohol per day, alcohol per week. How many alcohol glasses is he drinking or bottles is he drinking? Let's say for instance 1 to 5. And is the patient smoking? Is he ex-smoker, or he doesn't smoke, or he's smoking? And there it says per day, so he's smoking 15 to 20 cigarettes a day. Now what is nice, here you can type in notes. For instance, if you want to know what type of cigarettes he's smoking, or for instance, or which alcohol is he using. Is it alcohol that with only 2% alcohol in it, or is it really strong alcohol that he's drinking, and what type of exercises is he doing. He's exercising twice a week, but what type of, is he running, is he in the gym, depending on what type of information you need, and that also depends on your specialty, what do you want to know about the patient. Now from here we say family history. Now this is any history that is inside this patient's family, mother, grandmother, it doesn't matter. Is there asthma, for instance? Yes, there is somebody. Then you can type in how far in the family, for example, how far in the family do they have asthma? Is it only 3 generations back? Is it the same generation? Depending on what type of information you need for this patient. Then it's a hearing loss, for instance, heart disease, depending on what clinical family history the patient will have. Now from here, then if you're finished with the general history, please click on the complete, and you can see immediately what information didn't you complete yet for this patient. Now this is a once-off information that you have to do on the patient. So the first consultation of a new patient is always going to take a little bit longer, that you can fill in the medical history, because the next time when this patient comes to you, you're not going to remember everything that this patient has told you in the first consultation. So it's important that you fill in the medical history. It's not that we're not going to block anything if you don't fill in the medical history, but it's a nice to have to cover yourself when the patient comes back next time and there's some stuff that you didn't remember. Then we have your chronic conditions. Now here you can search for the chronic conditions, say like diabetics. Is it a non-insulin? Is it the insulin dependent? So let's take this one. Already, so if you don't know the diagnosed code, you can search according to the description. Otherwise, you search for the ICD-10 code itself. You can add more than one if you want to. Now, this is one of the, say for instance, one of the chronic conditions that this patient has. This date is from when does this patient have a chronic condition. So let's say it only started in the beginning of the year, for instance. Then if you have default script lines, you can add here and say, yes, I'm always going to give this patient this type of medication for this chronic condition that the patient has. You can choose it from the list. If you want, the G stands for generic medication. So if you need other medication that is the same as this one but a little bit cheaper, you can click on the G and it will show you if there is any generic medication for this type of item. Now let's take for instance Voltaren. That is not really a chronic condition, but Voltaren, and we click on the G. It will show us the item that is almost the same as Voltaren is Panamor or otherwise Valtex, and also the strength is 75 milligrams, and then how many pills is in the box. So it's a 30, a 50 and a 10. Now here you can see on the top it's Voltaren. The price for a packet is 194 Rand. Now the Panamor, that is exactly the same with the manufacturer, is only 132 Rand for a pack of 50. Or the Valtex is 132 Rand 88 cents, and also the price unit will show how much is it for one pill, and you have your percentage of the original amount. So how much money are you going to, the difference between the two. So now we're going to say save. If you don't want to choose another one, otherwise you can click on one of them and you can say, I actually want this item. Okay. Then you type in the dosage and you type in how does this patient need to take this medication. You type in the frequency, how many times must the patient use this medication per day or per day, and then the days applied. How long is this giving to the patient? Now, if I say frequently 2, you will see the days applied will go to 50 because there are 50 tablets inside this patient, inside this medication that you're giving to the patient. Now, if I'm telling the patient he must take 1 tablet 2 times a day, this packet is only going to will be available for him for 15 days. Now the total quantity is 30 in the packet, and now you can say when must the patient take this medication. In the mornings, is it 4 hourly? So let's take 8 hourly. Meal relationship, must it be with meals, before meals, after meals? So let's say with meals. And does this patient get a repeat? Say for instance the patient are allowed to get 2 repeats and then he must come back again, or mostly with the chronic conditions, you will see that the patient maybe have a 6-month repeat, and then you type in there a 6-month repeat. Now what's nice, if you completed all of this information correctly, the directions, the signata of how you must take this medication will already be filled in. Take 1 tablet twice a day, 8 hourly, with meals for 15 days. And then this can also be printed on the script. We're going to go through this again inside the scripting, but here you also can say include consumables if you want to prescribe as consumable for this patient. So now we've done the chronic condition, we're going to say complete. From here we're going to say the allergies. Now if you want to type in a warning message every time when you open this patient's file, because it's a really urgent, or not urgent, but a really serious, yes, that's right, a serious allergy that this patient have, or a serious problem that this patient have, you can put a warning message. So every time when you open his file, or when you make a booking for this patient, or when you start doing this billing, or when you work on the clinical notes, then this message that you have typed in here will pop up and tell you this is really important. You must please remember that this the warning message. Okay. Then you have your drug classes. You can choose from the list. Say for instance the patient is allergic to penicillin. You can tell there the system what happens to the patient when he gets penicillin, because some patients only get, for instance, a running stomach when you give him penicillin, so it's not that bad allergic for penicillin, but then you know, okay, yes, I can give him penicillin, but I have to give something for the stomach also, a probiotic, for instance, with penicillin, then the patient will be fine. Otherwise, if the patient is going to die when he's getting penicillin, you can't give him penicillin. So it's important that you write there for yourself what happens to the patient when you give him penicillin. So say for instance this patient will die, and then you have your natural allergies. Then from here you can choose a natural allergy, that is fish, cheese, chocolates, dust, corn, coffee, so anything that it actually isn't medication. Okay, so let's take, there is plasters and also wheat, tomatoes. Let's take tomatoes. You can there tell the system what happens when he gets when he eats tomatoes, he's swelling. And then we have the chemical allergy, so it's all the ingredients that you get inside of the medication. You can choose here, or otherwise you can start typing, and it will give you the correct item. Now there you can also type in what happens to the patient. Stop breathing. Okay, and then when you're finished with all of that, and you can put more than one. Okay, you can put a lot of on if you want, if you need to put more. So then we're going to say, let's take I want to make this one a paracetamol one also. Oh, sorry. And also if you made a mistake, you can just delete from here. Click on the minus button. Paracetamol. that we have a nice example. And then we say complete. We are finished with that. Now from here, the treatment history. So for instance, the patient had a lot of treatments, cancer treatments, or any kind of treatments that the patient had, or any other operations that the patient had in the past. You're going to create it here. You're going to say the beginning date, the end date, for instance, with the treatment, the place, and the doctor note, if they have a doctor note, and then also the operation, the date, who did the operation in which hospital, and if you want to put a note in. Now if we say at the operation, you can type in there what type of operation did the patient have. Remove leg, for instance, and then you type in the date, you type in the doctor, hospital, and if you have a note. If you made a mistake, you can just minus, and then it will take it away. If there was no previous treatments or no previous operations, you can just say complete, and you know, okay, yes, there is no previous in previous operations or otherwise treatment. Then you have your gynecologist history. Now here is the past pregnancies for the women's part. You can type in here, it was the full term that the female was working with the pregnancy, was there abortions, living, multiple births, add a pregnancy, so you can add how many pregnancies that does the patient that have. So fill in this, and then you say add pregnancy, and then it will put all of this information inside. Then no pregnancy added, yes, because this patient didn't had any babies yet. Then you also have your menstrual history. This is also important for the gynecologist, for instance, or also with the GPs if they have to send the patient for certain procedures. You also have your screening, counseling, all of this. You can click on it and then choose which one is the correct one. Then you have your infection history. You can say, yes, this patient was exposed to TB, for instance, and he has a history of STD, live with someone with TB, for instance, and you can also write comments here. Okay. Then you say complete. And then from here you also have your occupational and your history. Then your occupation, you can type in here. Now, for instance, say for instance, there's a patient that has a lot of lung problems because he's working in a mine. It's important that you know this patient is working in a mine. So the occupation of the patient's work, please type it in. It's also going to assist you in treating your patient. So let's say this patient is working in a mine, then you can do any notes if you want to have any notes. We say complete. And when everything is completed, then you can say, okay, yes, I'm finished with the history. Now, what is important is, say for instance, tomorrow the patient comes back and say, oh no, but I'm not smoking anymore. Then you say reopen. You say here, for instance, ex-smoker, because the patient did smoke in the previous. You say complete, and it close it again. Okay. Now all of the medical history is completed. If we go back to the clinical case now, you will see here is some buttons. You can decide on which buttons must be here. So this is your easy events that you can quickly click on it, and you don't have to click on the forms library and choose it from the long list that we have. Now, if you click, you can decide on which ones do you want to see here. Now, let's go and do a script for this patient. Scripting. Now, from here you can see there is a drug interaction checker, and also must it include consumables. Here you can see the previous scripts that was done on this patient, and then is a minimal expandable script. Must all of the fields be open, or do you want to minimize it? And then you have your repeatable script. Is this a repeatable script, yes or no? And can it be manually overridden, yes or no? Now from here you choose the diagnose. So let's take headache for instance. You can have more than one, so just double click on it and it will go to your added codes and you say save. There's your ICD-10. Now you search for your medication. Let's take Bernardo tablets. Immediately, because we've told the system that the patient is allergic to paracetamol, the system is immediately showing us red and it shows you, are you sure you wish to add Bernardo 500 milligrams to the script? The patient is allergic to it. So it immediately warns you. Okay, so we're going to say yes, we do want it. It's still going to show red because it's still a warning. But if you print, when you save and you print it, then it's not going to show. We're going to, let's change this and say Voltaren tablets, and then the red is gone. So then you can give the patient something else. Now the same process follows here as in the medical history. When you create this, you say the dosage, you say how must the patient take the medication, how many times a day must the patient take this medication. You will immediately see the days applied will go less because it was 30 tablets and the days applied is now 10 because you can only use it for 10 days. Then we have total quantity left, and we also have then the time of day. So for instance, the patient must take it 4 hourly, meal relationship with meals, and then the repeat. Is it a repeatable script? And then you will see here we have a chronic or a acute medication. So you can mark it as a chronic medication because we did put in Voltaren as a chronic medication. You see the C already turned blue because it went and take it from the chronic medication also. Okay? And when it's repeatable, it will also think it's going to be a chronic medication. Now that is also, the A is for acute medication, and then this mark as not substitutable. That means it will also print on the script, and when you send the script to the pharmacy will know they are not allowed to give any other medication for the patient except this one. Because sometimes when the patient comes out of pharmacy, they say, oh now this medication is too expensive, can you give me something else? Now in certain reasons, there is certain medication that the doctor says, no, you must take this one. No generic items or anything else, you have to use this one. Okay, now from here you can add another one and you can put in another item on this script. If you made a mistake, you can say minus. Okay. Then if you want to import from the chronic diagnosis of the patient, we can say yes, we want to import it from there. It will take from the medical history the item that you have completed in the chronic condition, and it can pull it into your script. So say for instance the patient comes and say, oh, can you please give me a new script for my chronic problem? Now if you click here, you can immediately see how many chronic conditions does the patient have, and then you can say, okay, yes, it's for this chronic condition, can I put it in? Then you can put in that chronic condition with that items. So it's nice to put it in the medical history because it's going to make your work every day when you have to see the patient really quick. You can also add more than one chronic script on one. Okay. Then you can say add script item, add favorite meds. Now add favorite meds is a list that you build for yourself to if you click on it, it will open a list that you're using the most, or otherwise the item that you say please add to my favorite list. So it's just a quick way that you can put. And what is nice, it saves the directions how the patient must take the medication. So let's take this one, not twice, only once. Save. Everything is already filled in for you. Okay. Now, save script lines to a macro. From here you can also build your own combination. So you can say save script lines to a macro, and it will go line a macro, and you can use that macro in the next in the future if you want to use that one. If you hover over the over this button, you can see here from you can choose the generic items, and also MIMS is an extra system that we have integration with. You have to be registered at MIMS, and then you will get a username and a password, and then you can type it in there. Now what MIMS does is they give you all the how does the item look like. The pamphlet that you get inside the medical items is exactly that pamphlet. What is the when the patient takes this medication, what is going to happen if you overdose, for instance. So everything is on the MIMS then, but you have to register at them to get that information. And then you have choose from history. You can go to your history and see what did you do, what did you give this patient previously, and you can also choose it from there. From here you can say the script history, must it be expand, show repeat, show chronic conditions, show acute. You can take it off, and then it will not print on the script. Here you can put a medical note in. For instance, you want to say something to the pharmacist, you can type in something there and give a medical note. And also then the doctor can sign electronically. So if we click on the plus, the doctor can sign electronically, and you can save. Otherwise, if you have a electronic signature of the doctor and it was saved, you can say loud user signature. But please just remember that not everybody must have access to this, because if you give your signature out to anybody in the practice, anybody can make a sick note or a script for themselves. Okay, we're going to say save. I just want to move this. Okay, now you can see a little bit better. Now from here we did put in the doctor's signature. If you don't want to do it electronically, you can leave the doctor's signature out and just print it, and then afterwards you can sign them with a normal paper. Okay. This as informed by patients. Say for instance the patient phone in and the patient doesn't come to your practice and say, doctor, I really have a bad headache, for instance, can you please give me some prescription that I can go to the pharmacy? Or he is really full and he can't get to your practice, and you know the patient, you can say, as informed by patient, you didn't see the patient, but the patient told you all of his conditions, and you will are able to give him a prescription. You can put that on. Now from here we are happy, we say complete. Now you can here say print, and you can print the script. Now the script will open. If it doesn't open, please phone GoodX immediately, that we can assist you, because it's supposed to open immediately and give you the correct view of the script. Unfortunately, this one on the test system is not working properly. We will have a look at that. And then from here, you can download it. Let's see if the download is working nicely. We click on the script, also not. Okay. You will see from there, you will see how the download looks like, and the print. If it happens on your live system, please let us know immediately, that we can have a look at it. Now from here you can reopen if you need to reopen it and change any information. You click on reopen, click on the script, change all the information that you need to change. Then you will see if you say complete, it will turn green. That means you're finished with it and you have to change everything that you have to. Now if you want to go out to the patient's main, to the diary again, you say save and close, and it will save the script that you have done now. Now from here, let's go and see how do we do a sick note. We click on a sick note. There's all the patient details. It pulls it through from the diary, and then you have the previous sick notes. So if the patient did have a previous sick note, you can see it here. It's really important that you look at it, because say for instance you see the patient is sick every Monday. The patient comes there every Monday, and then you know, oh, but this is getting regular, and you're not going to give the patient a sick note anymore, okay, because the patient is always sick on a Monday, for instance. Now from here you say the diagnose, what is wrong with the patient. If you don't know the ICD-10, you type in the description. It's a headache, for instance. Diagnose displayed on printout. Here you can type a message that it shows what is wrong with the patient. If you're not using the normal ICD-10 and the chosen diagnosis, you type in here what is wrong with the patient. That is a little bit more understanding language than the ones that is part of the ICD-10. Now here you say the date of treatment, when was the patient treated, and then absent from when is the patient going to be absent from today. Number of days is going to be absent is 10 days, and the absent to and including will automatically be calculated from the 7th plus 10 days, and then it will be on the 16th. Okay. Otherwise, the other way around, if you click here, you can say, okay, yes, I want the patient to be absent till the 12th. It will automatically calculate then the days of the days that a patient is going to be absent from work or from school, or we're going to get to that now. Then if the patient has to come for a follow-up, you can say yes, the patient must come for a follow-up on the 11th. And then if the patient has a light duty form, then you can type in here, yes, the patient can go to work, but it must be on light duty from the 13th until the 16th, for instance. Information, in my opinion, to my knowledge, or as informed. Now, this is decided by the doctor. Was it in your opinion that the patient can't be at work, or is it to your knowledge, or was you informed by the patient that the patient can't go to work, for instance? Now here you say the patient is unfit for school, and the patient is unfit for sport, and the patient is unfit for travel, for instance. Now here also we have prepared family responsibility certificate for the family member. Now this comes also in play when the patient has the patient is a child, and the mother must look after the child because the patient has measles, for instance, and the patient can't go to school. The child can't go to school, and the mother must stay at home and look after the child. Now here you're going to give a family responsibility leave for the patient, for the mother, and you're going to say family leave from to, so it will take the date, the absent from, until when must the mother stay at home. Now we install the system, yes, this person can go on light duty on the 13th, so we're going to say the mother must stay at home until the 12th. Family member that needs leave, so there you will type in the mother's name. You will give a reason for leave, look after child, additional comments if you want to put additional comments on, and then again you can click on the plus, let the doctor sign electronically if he wants to, and you can say save. You say complete. Let's see if we can print this one. Yes. Okay, so this one is, we can print. The other one, the script must also be printable. Please just double check that. Now on here you can send us your header and your logo that we can put it in. So this is customizable. We will pull in through the patient details. We will say medical certificate. This is to certificate that MST GoodX attended this practice on 2019 March on the 7th. In my opinion, she is unfit for school, sport, travel from that date until including due to illness or injury. Now that is the light duty and the normal duty, and follow-up appointment date. The patient requires care by mother, GoodX, until that reason and also until that date and the reason therefore. Here is the doctor's signature, and then also the doctor's name and the practice number and the date and time when this medical certificate was done. Now we say, you can say print or otherwise cancel. We don't want to print it. Just want to make something double sure. Now, because we didn't print it the first time, if we click on print again, it's going to tell you it's not original. So this is a duplicate that you have made for the patient. Now also on the second page, you will see there's a family responsibility certificate that a mother can give in to the practice. Okay. You can also download it and then email it if you want to, or otherwise here you can email it also. Remember to save and close. We also have a quick note, and the quick note you can add an image. You can do it from the camera, or you can load it from an external upload, depending on what you want to do. So let's see. Okay, this one is not going to be able to take it from the camera because we have the webcam on. Now, let's see if we can upload one of the computer. Pictures maybe, nothing. Not sure what is this. We'll see if you can get a picture from the internet maybe and save it, that we can show you how this works. Let's go and search for a picture. A leg. Let's take this one. Saved image. On the downloads. Going back. Uploads from file. Home, downloads. There is a foot. Now we've uploaded the picture, and on here we can also draw pictures, draw notes on site on the picture. So you can change the colors. We're going to use that one, and we're going to say the problem is with this toe, for instance, and it's there, and you can make like this. So you can draw anything, and also you can type. So if you draw your text box and you type there, problem area, and you can, if you made a mistake and you want to start over again, you say undo entire image, or otherwise you can use the eraser, and then if you're finished you say save. The picture will be there, uploaded, and then you can say leg problem, for instance. So you can type in any message that you want to. You can add another picture if you want. Then you say complete, and you can always print this, or you can download it or email it to somebody else if you need to. Okay. There's a lot of different forms that you can use. The other one that we just have to explain also is the general examination form. Now this is a really big form, but it's a lot of information, but you can decide on which information do you want to use or not. If you click on physical examination, you're going to say yes, okay, this patient has, for instance, pain, and you're going to type in any notes. If you need to put in images, you can put in images here, and you can add symptoms. What type of symptoms does the patient have? Now, what is really nice of the blood pressure of all of this, some of these fields, indicates for you when it's high or low. It shows you the blood pressure. Say, for instance, we're going to say 150 over 90. Then it's going to turn red because the blood pressure is too high. If you type in here 80, you're going to see the bottom one is not that high, it's normal rate, so it's not going to turn red, but the first one is definitely a problem. Now, say for instance the patient is on chronic blood pressure medication, you're going to say here, yes, the blood pressure the patient is using blood pressure medicine. Okay. Here you can type in the pulse. It's going to show you when it's high. You can type in the patient's weight, and then also the height of the patient, and the BMI will be calculated for you. Now this is also important for some billing purposes. If you are working with weight modifiers, this will also come in place. And when the patient is overweight, for instance, you're allowed to ask certain tariffs because the patient is overweight. If the patient is a smoker, yes. And then also here it shows you, is it a low risk patient or is it a high risk patient? You can type in the neck and the waist and the hip ratio, and the ratio will be calculated for you, and also give you indication if it's a high risk patient or a low risk patient. You have your your breaths per minute, and also your temperature. And if you type in here 39, it's going to give you a warning that the patient has a high fever. You also have all of your sugar and your urine and all of the other tests that you have. You also can click on your urine test and you fill in all of this information to complete all of the patient, your physical examination on the patient. Now here you can also say, is the patient HIV negative or positive? Is the patient pregnant? Does the patient have malaria or not? Then we get to the JACLD. Now, the medical practitioners will definitely know what JACLD means. You can add images here, or otherwise you can click on it and say, yes, it's fine, or no, we have a problem with it. And then you can type in the problem that you have with it. And then, for instance, anemia, yes, the patient doesn't have anemia, or yes, the patient does have anemia, and the patient is really, then the iron levels are really low. Okay, so you click on all of them, and if everything is normal, you say all normal. You don't have to go and click everyone to say yes, it's normal, it's normal, it's normal. Then you have so when you before you go to the next one, we filled in everything, we say complete. Now we go to review of systems. Now what is really cool of this, in all of them, not on all of them, most of them, if you click on it and you want to show it's a problem, it will open a picture. And on this picture, you can edit it and you can make nice notes, and you can show here is the problem. And you can draw pictures and you can draw notes and make any important information that you need to do. We're going to operate on this patient. We're going to cut here to show that it's that long cut. It's going to be a 3 centimeter cut, for instance. You can explain to the patient that what are you going to do also on this picture. And then you can say save. You can type in there any general notes, for instance 3 centimeter cut that we have to do. And then we go to ears, for instance. You have a lot of pictures on ears. There you can also type in certain information of the ear. Nose, the same. All of this, you have your certain options that you can use, and also pictures that you have, and certain notes that you can do on your clinical. So it's just a walkthrough with important information that you can have or that you can use, facial views. You can play around with this. There's really a lot of nice functions and a lot of nice pictures inside. You also have your respiratory systems, and here again you have some extra pictures that you have. Here is also the heart rate, the heart sounds that you can put in. There's a lot of extra tests that you can mark, or types of certain things that you can have to indicate on the patient. And then, for instance, we're looking at the ECG. There you can add a picture again of the results, for instance. You can have the abdominal. All of this has or pictures with it, or it has places that you can fill in certain information. And just remember, you can draw on the pictures, you can edit it, and also then you can add your own pictures if you need to. Okay. So please go and play with it, and then you can definitely have a look at all of this. Here is also psychological problems, and then the patient is OCD, the patient has anxiety, so, and you can also put some information inside. This is also cool. You can see all of the cool information. It shows you which part of the brain is connected to which sides. And here it shows you also your skeleton, what's going on there. There's a lot of really nice functions that you can use. If you're complete with this one, you go to the Diagnose and Plan. And here you can say, what plan do you have for this patient? With all of these problems that a patient has, you're going to treat this patient this way. Here you can say the clinical procedure that a patient must get to. You have your consultation fee, you can put on your procedures, your materials, your medicine, and from here you can already create your invoice. So you can say add to invoice. When the reception opens the invoice, all of these lines are already there. So the invoice is going to go really fast. From here you can also create a script, and you can say the outcome. Was the treatment completed? Was the script completed? Was the sick note completed? Must the patient be admitted? And so on. On the bottom you can say final all stages, and it will final all stages when you come to the bottom. And then you can say save and close. This form can also be printed and also be downloaded or emailed if you want to. Okay. Is there any questions about the clinical notes? I just want to see if we missed anything. To access the patient clinical note, let me just go back. If you go to, let's say, save and close. If we go to the patient, you'll see the C already turned green because we did put patient clinical notes on this appointment. We click on it, and then we go to clinical, and there is all the clinical notes that you have done on this booking, on this time slot. Now, say for instance, the patient comes tomorrow and you make a new booking, then you go to clinical, and you can say clinical history. And all of the history will also be here. Here you can view it, and it can show you exactly what was done on the patient, the general examination, or you can click on it and it will only show you what was filled in. So it's a short note, what did you all fill in and what was correct and what was not correct on this patient's general examination. There is the quick note, it shows you the picture and then also your note. Again, you can print it and you can email it from here. Okay. So if you want to see the clinical history of the patient. Otherwise, you can go on close and it will go back to your home screen, to your diary screen. Let's just see what we did spoke about the medical history, we did spoke about the allergies. Easy event setup is all of these icons that you have, these ones that you can choose which ones do you want to see, and then from here we just want to see prescription. Yes, we did do a sick note, a referral letter, a quick note. A quick note we didn't do a referral letter. Let's just do a referral letter. We go to clinical. On this, we search for a referral letter. Okay, here's not a referral letter for us there. So now we're going to search for it here. No, that's not the correct one. If you don't want this one, you can just say click on delete and it's going to be deleted. If you want to make another sick note, for instance, you can click on copy and it will give you another sick note. Okay. I just want to see if we have a referral letter. Unfortunately, we don't have a referral letter on the test one, but it works exactly the same as the sick note and the script. It guides you really nice how to fill in all the information and what type of information next. And also just remember that you always have to complete and then save, that you make sure all of your information is captured correctly. Okay. Is there any questions that you have about the clinical notes or the clinical administration part? Okay, we're going to take a 10-minute break again, and then we're going to come back to the billing part. Thank you.